Welcome to the Mobility Screening and Solutions tool. Our goal across the Veterans Healthcare Administration is to safely move and mobilise all of our veterans to their highest potential and to keep our caregivers safe in the process. In order to do this, we need a common language and a standardised way to determine how much our patients can safely move by themselves and what activities they require physical assistance with. All care team members, including patients and their families, must understand the terminology and how the MSST can keep everybody safe. The Mobility Screenings and Solutions tool has two main purposes. One, to establish how the patient can move right now. This is their baseline status. And two, to inform decisions about how to safely accomplish the desired activity. Begin the mobility screen to see what the patient can do. If the patient has strict bed rest orders or bilateral non-weight-bearing orders on their lower extremities, they will automatically be an MSST level 1. Ask the patient to try and sit up. The patient can use the bed or the bed rail if they need to, but what you're looking for is that they can sit safely unsupported and they can shake your hand across the middle of their body once they get there. If the starting point is a chair, ask them to sit forwards and stay in that position without resting on the backrest or using their hands for support. If they cannot, then you know they need help even to sit. This patient is level 1 and requires total assistance. If the patient successfully passes step 1, you know they can sit up independently and you advance to the next step. The next question is, can they stand up safely by themselves or do they need help? Before we even ask them to stand, we need to know if they have good strength and movement in their hips, knees and ankles. Trying to stand up when both legs are weak and do not have the movement needed puts the patient at risk for a fall and also puts the caregiver at risk for an injury. Ask the patient if they can stretch out their leg and point their toes. They must be able to almost fully straighten at least one leg to pass this step. If they succeed, you know they have enough strength and movement to go on to the next step. If they are unable, they will remain at MSST level 2 and require moderate assistance. The action of raising the butt cheeks off the surface from sitting to a standing position also requires the gluteus maximus or the buttock muscles. Ask the patient to try and stand, clearing their buttocks from the bed or the chair, and holding for 5 seconds. They should be able to stand safely without swaying or faltering for the full 5 seconds. If they are unable, they will remain level 3P, which means they need a powered device to help them stand up. If they succeed, even if they have to steady themselves on the bed rail or a cane or a walker, you know they are safe to stand and can progress to the next level. You now know that they can sit up and stand up independently. Next, you need to determine if they can walk safely by themselves or if they need help. Ask the patient to march in place and then step forward and back with one foot and then the other. They should be steady and have no loss of balance. If the patient is unable, then they will remain an MSST level 3N. They may require the help of a non-powered stand aid or device, and they will need assistance to walk. If the patient has passed all the mobility screening steps, they have demonstrated the ability to sit up, stand up, and walk independently. They have reached level 4. If they need an assistive device, they are MSST level 4A, which means independent adaptive. If they do not need a device, then they are simply level 4. So let's just review the levels one more time. Level 1, total assistance. The patient can move in bed, but cannot safely and independently sit up and shake your hand, crossing their body without help. Level 2, moderate assistance. The patient has enough strength and balance in their body to sit up and shake your hand, but they cannot completely straighten their knee and point their toes on at least one leg. It is not safe for them to attempt standing without help. Level 3, minimal assistance. The patient has enough strength and movement to attempt standing up. 3P, these patients need powered devices to help them stand, as they are unable to stand for 5 seconds without swaying or faltering. 3N patients can stand without swaying or faltering with or without support of a non-powered stand aid or device, but cannot step forward and back steadily and with good balance. They cannot walk without help. Level 4 is independent. The patient can stand up safely and independently. They can step forward and back steadily without losing balance. If an assistive device such as a walker or a cane is needed, they are level 4A. If no device is needed, they are simply level 4. Now that you have learned the purpose and the levels of the MSST and watched the demonstration, your task is to grade each of the patients in the videos to the best of your ability. Simply watch each video and rate the patient's MSST level. If there are any that you are unsure of, choose what you think is the right answer. You can note any questions or comments on the paper, but you must choose one answer for each video. Thank you for your participation.